Hello, everyone, and welcome to the second day of the IIPDW conference. We're thrilled, absolutely thrilled to have you all here. Before we begin, I'm Swapnil Gupta. I've thought about introducing myself as a recovering psychiatrist, but and that's one way to do it. But so I'll point out a few of the housekeeping issues before I introduce today's speakers. We have a Q&A box at the on a strip at the bottom. So please feel free to enter your questions there, and I will keep track of all your questions and present them to our panelists today. Please note that we're not going to be able to offer direct medical advice, but we can speak to broad themes that the questions introduce. So with that, I'm going to talk about our two panelists today, Mark Sanderson and Sandra Jayacodi. Welcome and thank you so much for being here with us today. Mark was born in Zimbabwe and moved to the UK at 19 to work as a pastry chef, hoping to be a high flyer in the chef world. His hopes, however, were overshadowed by his experiences of psychosis and the treatments that followed. During his 8th psychiatric inpatient admission in 2015, and 5 years of being heavily medicated on antipsychotics, mood stabilizers, antidepressants, Mark watched Eleanor Longden's video, The Voices in My Head, and started attending his local Hearing Voices group, which offered different perspectives and supported him to realize that change was needed. In early 2016, with the help of his clinical psychologist and psychiatric nurse, Mark started his long-term goal of tapering off all his medications. After 18 months of what felt like a lonely journey and a bad decision at times due to how difficult it was, Mark managed to come off all his medication. Mark has since been working in various roles in National Health Service over the last 5 years and is currently working in a lived experience leadership role. Mark is also completing his MSc in mental health recovery and social inclusion. Welcome, Mark. Sandra Jayacodi, a practicing solicitor, had to leave her profession following years of battling with bipolar and psychosis. She used her lived experience to become a volunteer and trustee for a mental health charity, then became an improvement fellow at the NIHR Collaboration for Leadership in Applied Health Research and Care, Northwest London, peer researcher at the McPenn Foundation, a lay chair for Imperial Biomedical Research Central Public Advisory Panel, and a patient and public involvement contributor for various healthcare and academic organizations. Within Central Northwest London NHS Trust, Sandra holds many roles, including Service User Advisor on the Improvement Academy Board and the Physical Health Strategy Steering Group, where she is helping improve communication and clinical decision-making between clinicians, patients, and families around the use of antipsychotics. Sandra uses her lived experience to educate others about the importance of making an informed choice about treatment options, where the potential side effects are always discussed, along with the dangers of overprescribing and the need for regular medicine reviews. Sandra is also a member of the Lived Experience Advisory Panel for the research into antipsychotic discontinuation and reduction, the RADAR study, led by Professor Joanna Moncrieff, and the patient and public involvement co-applicant for the RADAR long-term follow-up study. Her involvement in the study has inspired her to reduce and discontinue the antipsychotics she was on for almost 15 years. Welcome, Sandra. Thank you for being here.
Thank you.
So let's start with Mark, and Mark will tell us more about his story.
Thank you. Can you see my slides?
Yeah.
Yes.
Cool. Brilliant. Okay. Hello, everyone. Thank you for the introductions. My name is Mark Sanderson, and I'm going to be talking you through my journey of kind of getting into services and coming out of services and all the treatments that came with that. So, like introduced, I'm Mark. I'm 34. I was born in Zimbabwe and grew up there until I was about 14. Then moved to South Africa. Pastry chef by previous background before working in the National Health Service in the UK now. And I really love cold water swimming, cooking, and being outdoors. And one thing I will say is, there may be some content here that is quite upsetting to hear. So, if you do need to take time away from your screen or take a break, please do. But I think it's important that I'm honest about my experiences because, this is the kind of things I lived through. Growing up, I went to boarding school in my early years of school, and I absolutely hated it. I hated school in general. I wouldn't say I was academically an achiever or considered that either. I had 3 major traumas in my early teens, which every time that happened, was mentally very damaging for me, but then also led to me missing a lot of school. So I was always behind in school, and I only just scraped through school. I had to stop maths when I was 14 because I told I wasn't clever enough to pass it. So that was, there was lots of things that happened that really kind of impacted my growth within perhaps society, or I felt impacted my growth. But I really love sport and I was really good at it. And this is going to be a theme that's probably going to go a bit later on when I talk about when I started using medication. And then once I'd finished school, I qualified as a pastry chef, and I absolutely loved that. I finally found something I was good at. Felt I was quite good at sport, really good at cooking. I considered myself quite a renegade in the kitchen and loved to experiment and to deconstruct kind of traditional dishes and really put my own spin on things and use my own creativity. And, I considered myself to be pretty confident in the kitchen, probably quite cocky, a bit of a wannabe chef, and really back myself in my decision making. But unfortunately, as kind of my chefing journey went on, it became a bit of an obsession for me. And I kind of got really ingrained. It was pushing to be the best pastry chef in the world at the youngest age, even though I didn't quite know what that looked like. But it was something I felt I needed to achieve and needed to prove to myself. So I sacrificed a lot of my own health and well-being to try and achieve this mission. And as these pictures show, I used to take a really kind of traditional dish or kind of understanding of something and break it down. And this again is going to be a really important thing as I talk through my slides. And again, to experiment. I love to experiment with flavors and think about how to use different flavors. And, I was really kind of, I was a really creative person and really I felt thought in a very different way to lots of other people, which I felt was one of my strengths again. But unfortunately, the more I got into chefing, like I said, and, I became quite addicted to this idea of trying to experiment and take it to the next level. And I unfortunately decided I needed to sacrifice my sleep to start creating all these recipes and things that I could use in the kitchen, because I did feel under pressure to perform from myself, but also, just to perform in work. So I decided to sacrifice sleep and just create recipes. And I did this for 4 days. And unfortunately, 4 days without sleeping, it's not going to go down well. And it didn't go down well, unfortunately. And one day I went into the kitchen and I just started hearing loads of voices in my head. And also all my machinery, kitchen equipment, everything started talking to me and telling me that I was making the recipes wrong and how useless I was as a chef. And that was really difficult to take. But then as the kind of weeks went on, the voices became more kind of violent and also kind of started to put threats that if I didn't hurt myself, then my family were going to be hurt. So I acted upon those threats and unfortunately was, hospitalized. And on my second admission, I was diagnosed with bipolar. Didn't really know what that was, kind of got told what it was. And I was given a lot of medication. So I was put on antipsychotics and mood stabilizers and antidepressants. Kind of told how they would change my life, was told I would put a little bit of weight on, maybe be a little bit more lethargic, maybe not able to work to to the kind of quality I would like to, and have the same jobs I had. And I was more kind of told a plan and told what was going to happen to me. Everything was really negative. And after taking trial and erroring masses of medications, different mood stabilizers and antipsychotics, I was eventually put onto clozapine. I don't know if that's the generic name all over the world, but I was put onto clozapine at age 21 and told this was a last resort medication because I was treatment resistant, which is the last thing you want to hear when you're 21 years old and hoping to become the best patient chef in the world. So that really upset me. And yeah, all these experiences just felt really negative, and I wasn't given enough information, and so it just made me withdraw from that. And I decided to take all the medications because I felt if I engaged in the process too much, I would also not have time to become the best chef in the world. So, that was a really kind of big moment for me in my early 20s, and it could have gone either way. And unfortunately, it went a very downhill way. And actually, things just started to get worse. I felt very numb from the medications. I felt drowsy all the time. I felt hungover, constantly hungover. And unfortunately, I just became a hostage in my own head. I didn't have the energy anymore to support myself. I felt the medications really numb myself out, really numb my creativity as well. I couldn't think of the creative motion. That was really upsetting. I lost a lot of my cooking skills just because I got the shakes from being on so much medication. So, everything just started to go wrong for me, unfortunately, and that was really upsetting. And I did lose myself. I became a care plan, I feel. I wasn't kind of emotionally myself or physically myself, because by this stage, after 3 months of being on clozapine, I think I gained about 6 stone, which is, a massive amount of weight in a very short amount of time, which then impacted my ability to kind of do the things I like sport and things, which is why I talked about loving sport at the beginning. Also had a cognitive shutdown. I feel I couldn't think. I had constant brain fog. And even if I did try to kind of think outside the box, it was just stopped. And for me, that was really upsetting, because as a chef who was trying to create and deconstruct everything and think differently, that also got taken away from me. And growing up in Africa and hearing voices was also quite a surreal experience, because, from a Western point of view, from the doctors I was seeing, from a Western medication, there was a feeling that, these were problems in my head. I was told about the chemical imbalances in my head, and that, that everything was a problem. They needed to treat and cure this. Whereas kind of, other, maybe kind of the local people also felt that I had spirits and demons in my head, and those needed to be eradicated from my head. So I just felt very confused with what was actually going on for me. And, this is just, I think where I've put this care plan picture is, this is what my life became. It became long labels, long medication names, and, different kind of care levels and what I had to do. So it was just a really challenging, upsetting time. And as you can see on the left, that was me when I was 20, quite slim in my kind of zone. And after started taking clozapine in the middle, and the picture on the right, clearly things did change for me. I put on loads of weight, and, physically and kind of my soul was all changed. Everything was different. And it was just a really horrible time, because, I felt so much self-stigma towards myself. I felt like a failure. I felt like a burden. And over a 5-year period, so between 6 years, nearly 2009 and kind of 2015, I had 8 hospital admissions, 5 in England, 1 in Wales, and 2 in South Africa. And the most difficult thing is normally when I would get a job and really think I was back on track and starting to fly again and become the best patient chef in the world, I would end up in hospital again. So it was just kind of like I was a yo-yo, and it was called a revolving door patient. And, very little hope was kind of given to me in the ability to recover. And I saw 8 different psychiatrists over that kind of 6-year period, and all of them had a different kind of thought of what was right for me. All of them tweaked my medication. I stayed on clozapine for 5 years, but all of them added extra antipsychotics. And at one stage, I think I was taking up to 14 tablets a night, because I was also having to take medications for the side effects that the antipsychotics were giving me. So yeah, I was just kind of, constantly taking medications. Over the years, I had multiple diagnoses and labels put on me, which kept changing, which didn't make it easy to kind of find consistency and feel like I knew what was going on. And in fact, being diagnosed with schizophrenia and paranoid schizophrenia, I only found out 2 years ago those had been labeled. Those labels had been given to me, and it was because I requested my medical information from the doctor. So that was also really upsetting to know I was being treated for those illnesses that I didn't even know that I had. And I don't really believe in my diagnosis, as if I'm honest, but these are the labels that have been given to me over the years. And on the kind of middle and right column, those are the medications that I took over the years. There was constantly just chop and change, and it was really difficult to know what was going on and which medication was going to work, if any were, because they had so many in me at one time. But in 2015, was the start of the big changes for me. So I had 3 admissions in 2015, really, really hard admissions. The more I went into hospital, the longer I tended to stay, and the more kind of difficult they got. And luckily, I got in my last 3 admissions, I got to work with a really good clinical psychologist around, who really helped me kind of think about my experiences and what they meant for me. He came from a completely non kind of biomedical approach, which no one had ever done with me before. And that was really great, because it did help me to think differently about what was going on in my head and why I was kind of reacting to these experiences the way I was. And it started to kind of support me towards acceptance of my experiences. And I wasn't trying to find a cure anymore like I had for so long. I was going to kind of try and learn to live with these experiences and manage them. And at the same time, did some work with him, and decided also I was going to start tapering off my medication, and joined the Hearing Voices group, which was a really kind of pivotal part in supporting me to take that, what was going to be a very long process. So how I did this in 2016, after those 3 admissions, I decided I needed to firstly do it in stages. So I went back to that deconstruction I did as a pastry chef, and break everything down and try and do different things, and started to experiment, but just in a different way. So I quit chefing, which was massive for me. I was definitely going to focus on managing and not getting a cure. I chose a new career and was going to work in peer support, supporting others to kind of work through those experiences. And I started to taper, and it was really difficult because there wasn't any information given to me. My antidepressant was just stop cold. So I went kind of cold turkey on that. And whilst coming off all these medications, I started to have terrible physical experiences. I started to sweat. I started to feel really, really anxious, kind of butterflies in my stomach, something I wish I hadn't felt for ages. I was, I just felt really uneasy in myself. My sleep was terrible. There would be some nights where I wouldn't sleep at all, or just couldn't sleep. So it was a really lonely process. But I felt I had built up strategies that I could support myself and get through this. So it wasn't just about medication anymore. I was going to go to groups. I was going to try and exercise, and use different coping strategies to get through it. And if I didn't have all these coping strategies that I built, like this box here, with all these different aspects of my life, I don't think I would have been able to taper off the medications, because I did most of it on my own, because there was no medical kind of information given to me. And in 2016, I managed to get discharged from the secondary mental health services, so community mental health services, back to my GP, and continued to work towards being medication free. And I came off the injection I was being given. I had already come off clozapine, was on an injection, managed to come off that, and was then given an oral antipsychotic with the hope to continue tapering. And I had also stopped my mood stabilizer, and also got my driver's license, which was pretty cool, because I was like 28 and really was wanting to get that. So things were starting to improve massively for me. And then once I felt kind of emotionally in a good place and able to kind of support my well-being much better, I then kind of went on to the physical rebuild. So building that kind of physical health, wellness that I had before. So I came off all my medications. It was really difficult because at the last step, the GP needed to take me off my antipsychotic and approve it, and they really, really were skeptical. And it took a massive amount of me advocating for myself to agree that this had been planned and it was what was going to be happening. I joined a gym, I got into a new relationship, and I kind of made quite a few new friendships, which was great. Unfortunately, I lost some friends and also repaired a few friendships, and my family kind of relationships were improving by the day, because those got really kind of damaged during my period of being unwell. So that was really great. Yeah. And then the next year I decided to go back to the education I missed. So like I said earlier, I missed loads of school, got told to stop maths when I was 14. So I decided to sign up to maths and also go to college, because I felt I had missed those opportunities from when I was younger. And yeah, that was a great time for me. But unfortunately, in early 2018, or middle 2018, actually, I just started college. I was moving house and I was about to do my maths exam. Things got on top of me. My head was kind of really unsettled again. I was hearing lots of voices screaming in my head, really worried about things. My GP kept saying, you need to go back on medication, you're getting unwell again. I started to question myself, like, am I relapsing? Am I not able to support myself? But luckily I went back to those old techniques that I'd learned and managed to support myself through that. And luckily, greatly passed my maths, I passed college, got accepted onto my master's degree, which was a pretty big thing for me because I kind of didn't do undergrad, so went straight to master's. So that was a really big kind of achievement for me. But then again, in 2019, had another kind of blip around when I was starting my master's. I was really stressed and anxious, but also really excited, but also again told I'm about to relapse because of my stress and how I was doing. But I was having massive physical health difficulties from kind of coming off the medication, still those things that I had at the beginning. When I started to taper, I was still experiencing those, and I'd been to rheumatology, all sorts of specialist doctors around supporting me with some of these complications I was having. And I wanted to go for another scan around some gastro issues I was having, and the GP said to me that because he felt I was relapsing, he would only refer me to have the gastro support if I saw a psychiatrist, because he was worried I was becoming unwell. So I just decided to do it because I just needed that support. And when I saw the psychiatrist, they were very unhelpful because they just wanted me to go back on medication, and I said no, and they reminded me that it could be forced on me. But luckily I worked in the health service now, and I was able to tell them that I'd sat through enough mental health assessments to be able to kind of get through that and things like that. But it just felt really frustrating that that was happening to me. So I kind of negated the coercion they were trying to put on me. And then also managed to get through to those physical health supports. And actually the doctor in the gastro team said, that he felt all these physical health complications I'll be having was due to the withdrawal of the medications and losing all the weight so far. And I suppose just to say, kind of where things are today, I live in a happy home. I'm married. I've just become a dad, which is pretty awesome. I'm a kind of alumni of the Global Mental Health Peer Network, a member of the International Institute for Psychiatric Drug Withdrawal, which is why I'm here today talking about it. And, generally manage my well-being pretty well, I would say. Passed my master's, which is also pretty cool. And yeah, generally happy being me and still enjoy cooking. And I must say, since I came off the medications, that creativity, that ability to kind of think outside the box, and it all came back. So it just showed how kind of strong those medications were and how they did dampen all those things for me. But actually, I still hear voices to this day. I still have these different experiences go on in my head. So, clearly what they were trying to treat with the medications didn't work. But actually, I've come out in a much better place, I would say. And just a few pictures just to kind of put into kind of emphasis that what this treatment did to me. I would definitely go through this experience again. It's definitely made me a stronger person and kind of made me in a much better place to manage my life. But as you can see, massive changes happened to me kind of mentally and physically through these pictures. And I think it's just really sad that I wasn't given the full information as to the kind of harms that those medications were going to have on me. And I think, hope is such an important aspect. Again, something which was really lacking probably a lot of the time during my service use. But, I've managed to come through all those challenges. And, I think for me, I've got a real kind of question is, how come it's so easy for me to be prescribed all these medications and constantly be added to the cocktails? But why is it so hard for me to come off those medications? Or why wasn't I given an exit strategy? And I really wish we could, have such a much better focus on kind of supporting withdrawal. Then we spend so much time to managing concordance and things like that. Why don't we put as much effort to support people to have these exit strategies and to come off this medication? So that's my big ask for, and something I will continue to try and explore. But I'm just really grateful I managed to get through all this, and I'm still able to do my cooking on the side and keep myself busy. And this kind of picture was created by an artist when I told them my journey of kind of going what I went through and thing. And the picture on the left is the chocolate molecule, the molecule for chocolate. And on the right is the phoenix, also made out of a chocolate sculpture, because I used to do a lot of chocolate work when I was a pastry chef. So, big changes over the years. And I just think it's really sad that sometimes we're in the kind of mental health services, we're so fixed on kind of one medication diagnosis and all that, but because actually in my experience going kind of the opposite of that and being able to kind of deconstruct my own experiences and work through that really helped me kind of get to where I am today. So thank you for listening, and I think I will be taking questions at the end. So cheers.
Thank you so much for that powerful story, Mark. We've had a lot of questions come up, and what I'll do is invite Sandra to talk to us and then pull up themes from all the questions that have been addressed to both of you and save our discussion for the end. I hope that sounds okay. So Sandra, I'd like to invite you to present your story now.
Thank you, Swapnil. Let me share my screen. What is that? Oh, is this the one? I'm sorry, I can't. Just hang on, please. Yeah. Can you see the screen?
Not yet, Sandra. There is a button that's turned green. And it says share screen. So if you just hit that should share your slides with us or share your screen live with us.
Share screen and oh my God, what happened? Just give me a few minutes, please. Yeah.
Sure.
Can you see that now?
Not yet, Sandra.
No. Okay. Hang on.
So while you're doing that,
you can. Yeah.
maybe I can
Questions. Yeah.
start with a couple of questions if Mark is open to that. There we go. Now we see your screen and
The screen.
yeah. Now you just need to open your slides and
Yeah. Can
be
you see
good to
now?
go.
Yeah. Okay. Yeah.
We can see your screen, but not your slides. So if you just expand your PowerPoint, we'll be able to see your slides as well.
You know what?
Hello, Sandra.
I'm having difficulty. So sorry, guys.
I think if you open your slides first and then come back to Zoom and press share screen, then it should give you the options and you should see.
So now I've opened the PowerPoint. Can you see the PowerPoint? Yeah.
Not yet, but if you stop sharing and then go back and press share screen again.
Okay, share screen.
It should pop up with some options.
Okay.
And one of the options will be your slides.
Can you see the slides?
Yes, there you go. Yeah.
So if you just make them into a play, press play.
Oh.
That button, perfect.
Yeah. So sorry, guys. Can you see now?
Yes. Yeah.
So sorry about that. Okay.
No problem. And then I guess, yeah, great.
Okay. My sincere apologies, everyone. I thought I had it fixed and it still doesn't work for me properly. Okay.
No worries. No worries.
Thank you, Swapnil. Okay, hello everyone. Yesterday I was really overwhelmed by the conversation on the chat and questions raised around the topic of reducing and discontinuing the medications. And today we heard Mark. What a powerful story from Mark. So it just goes to show the strong appetite for reducing and discontinuing antipsychotics for mental illness. So today I want to share with you my personal experience of reducing and discontinuing antipsychotics. I couldn't emphasize more that everyone's experience is different. Some of the things I will share is hard for me, but I'm sharing them because they are real. By telling my story over and over again, I learned that I'm not a slave to my diagnosis or my medication, but a survivor who lives to tell a tale that with the right support, I too can thrive and flourish without medication. So I hope my story today will create an opportunity to learn from my experiences as with the experiences of many others who have gone through this journey, I'm hoping that clinicians and healthcare providers would initiate conversations with the patients, service users, and carers, and support them with reviewing, reducing, or stopping their medications. And at the same time, to enable and encourage patients, service users, and carers to have their own conversations with them. I also hope that the patients and service users and carers would feel motivated to have conversations about their medicine. So in my story, I hope to cover my background, my diagnosis and medication, the side effects, reasons for reducing and discontinuing, experience of reducing and discontinuing, the support, fears and barriers, and some take-home messages. So a bit of background about myself. I'm 65 years old. My name is Sandra Jayacodi, and I'm of Indian ethnicity. I was born in Malaysia, came to the UK to study law, and eventually settled here. I practiced as a solicitor and had my own law firm before I was signed off, unfit to work, following my diagnosis with mental illness. These photos of me and my siblings with my grandmother, we grew up without any toys. I mean, there's no toys for Christmas, or there were no toys to your birthdays. And nature was our only toy and our playground, courtesy from my father, who had a passion for hunting and fishing, and I loved it. So while I was growing up, I experienced childhood abuse and depression in my teens, but never spoke about them, as such things are not spoken in the environment and community that I lived in. So looking back at my lifestyle, I could also identify my extreme highs and lows in my mid-20s and 30s. I had received counseling sessions during my university days and during my pregnancy. Following the birth of my daughter, I was diagnosed with postnatal depression. So it was not until late 40s the childhood abuse started to manifest and began to take a toll on me. There were bouts of depressions and highs. I was also going through a very rough patch with my career and my relationship in the marriage. I was not sleeping. I could stay awake the whole day and go to work the next day and come back feeling so depressed. And I also was suffering from anxiety. It took a lot of persuasion from my GP for me to seek psychiatric care. The reason behind that was the stigma that was associated with mental illness. It was not just a stigma from people around me, but also my internalized stigma. So following a year of unsuccessful outpatient treatment and care, I ended up in a psychiatric hospital for 4 months. And I was told that I was suffering from depression, bipolar, psychosis, PTSD, ADHD, and hearing voices. And this was confusing. I always felt my head was very heavy and was about to burst. So now I can realize, with all this going on in my head, why wouldn't it burst? So besides being pumped with every color medication one can think of, I had also had lots and lots of therapy sessions. This art you see on this screen is my work of art during the art therapy. I would consider that my masterpiece. I remember during one of my sessions with my psychologist, I asked if there is any way of recalibrating or washing my brain. This used to be our joke. I felt a bit relieved when she told me that other patients have also asked her the same. That was a relief for me. Didn't feel alone after that. So when I was admitted and being assessed, I was put on so many different drugs. I was badly affected by one of them, that my blood pressure went so low and I could not get out of bed for a couple of days. I became paranoid about the medicines after that. I drew the shape and color of these tablets so I could check if any new ones had been added. I was actually on lithium, quetiapine, Adderall, aripiprazole, to name a few. I was in hospital for 4 months, and not once I was informed that I had to take them for the rest of my life, or about their side effects. Nor was I informed that I had the right to have my medication reviewed and how that will look like or that there is the possibility of me reducing or discontinuing them. I was also not informed about whom I should consult if I had any queries about my medication. So let me talk through the side effects that affected me. I'm sure many of you can also relate to this, and we have heard Mark speak about them too. I do not know if my mental illness was more severe or the side effects. These are some of the side effects that I experienced from the medication. So there was lack of energy. I would feel very tired and sleep during the day. I would not wake up till midday. I was putting on a lot of weight. I put on about 2 dress sizes. I experienced poor quality of life and was also affecting my physical health. I became over dependent on these medications, and I also started feeling involuntary movements in my hands. So it is assumed that patients will read the information leaflets that came with the medicine. I never read them, as the writing was so tiny and it used to annoy me. But most of all, I believed doctors are second to God, and they would not let any harm come upon me. All must be good. However, as many of you already know, these side effects can be dangerous and affect the quality of your life. I would sleep, like I said, till midday. I would feel like a zombie. I would not smile. I lost the purpose of life. I would schedule appointments only in the afternoon. I felt embarrassed and ashamed of myself. Among all the side effects, the one that worried me and caused a lot of anxiety was gaining on weight. I feel like I would feel so hungry after taking that medication that while I was in the hospital, I would go to the cafeteria and bring 1 portion of food, hide it under my bed, and then go back to the cafeteria and eat another portion and bring another portion. So my lunch would be like 3 portions instead of just 1. And during the 4 months of stay in the hospital, I put on 2 dress sizes. The weight gain was never discussed during my hospitalization. Following discharge, I would raid the fridge, especially at night. I remember once telling my psychiatrist, I'm overeating. I did not know he think it was a joke. He told me to put a lock around the refrigerator, but he forgot to tell me where to keep the key. My weight stopped me from socializing. I was a social butterfly, my friends would call me. It made me further depressed. It brought my confidence level to 0. I started overeating and forced myself to throw up, even in restaurants. And that led to bulimia, which I had to seek separate treatment for that, as I started seeing blood in my vomit. 7 years after taking this medication, I also came to know, through one of the quality improvement work that I was involved in Mental Health Trust, that the life expectancy of people with severe mental illness can be reduced anything between 15 to 30 years. I was very upset and angry when I came to know of this. I felt betrayed in a way. Why didn't anyone tell me this? Could these have made a difference in the way I took care of my physical health? These were questions that were running on in my mind. So why I decided to reduce and discontinue? I asked myself, was this by chance, or was it God having a plan for me? When I was asked to join the RADAR study, which stands for Research into Antipsychotic Drugs Discontinuation and Reduction, as a lived experience advisory panel member. This was the best thing that happened to me. The study was an eye-opener into reducing and discontinuing antipsychotics. Prior to that, I had no clue that I could actually reduce or discontinue my antipsychotics. So through this RADAR study, I began to understand and was more aware of the side effects, and that there's a possibility for reducing and discontinuing my medication. I also had the opportunities to hear the stories of the participants and their journey on reducing and discontinuing, the battles that they were facing. Understanding that it is not the same for everyone was very crucial for me. It gave me a sense that I have the right to talk about my medication and reduce it if I want to. The thought of being free from medication excited me. But at the same time, I was afraid of what if it did not work for me. I was prepared to give it a go. So when I was admitted and being assessed, I was put on so many different drugs. I think hang on. Yeah. So what supported me through my journey? When I was let's hang on a minute. I think I've got my slides wrong. Yeah, so when I was when I was in the hospital, I was on 600 milligram of quetiapine and 800 milligram of lithium. So my first attempt to discontinue the drugs was through the help of my psychiatrist. I asked if I could reduce the antipsychotic that I was on. He said, okay, and reduced it by 100 milligram. There was no discussion about withdrawal symptoms or relapse. After 6 months later, I had an episode and was feeling suicidal. Then I was told by my psychiatrist that I had to go back to my 600 milligram again. There was no further discussion about reducing the medication after that. That was a bit of a disappointment for me. I really felt disheartened. A year later, I decided to reduce on my own, as I was afraid to approach the topic with my psychiatrist again. I started to break the tablets on my own. The problem was it was not the same size each time. I reduced from 600 milligram to 200 milligram. I was doing well. And I also reduced the 800 milligram of lithium and discontinued it completely. I then decided to go cold turkey with a 200 milligram of quetiapine. I wanted to be drug-free before my upcoming birthday. Looking back, this was not a good idea. I started experiencing withdrawal symptoms, insomnia, cold sweats, nausea, restlessness, agitated, and was anxious. And my family members saw something was not right with me. But eventually, all settled except for the insomnia I was struggling with. I wanted to go back on the quetiapine and was not sure what to do. I did not want to approach my psychiatrist. I was really totally in a bad place at that time. But fortunately, on the third attempt, I decided to do it again. But at this time, I was told I'll be seeing a different psychiatrist due to some changes within the trust. So my first encounter with her gave me a sense of hope and that I could trust her. I really put my hands up to her like that and told her that I have come off lithium and quetiapine completely, but I was struggling with insomnia. I felt such a relief after telling her the truth because I was afraid of what was happening to me. She was very supportive. She started me with sleeping tablets. I was over the moon after that, but realized I have become dependent on sleeping tablets. And I was then referred to a sleep therapist. It was going on well, and I was reducing the sleeping tablet, but could not stop it completely. This went on for a while, and then I started experiencing suicidal thoughts again and was getting depressed. I could not sleep without the sleeping tablets, and this was annoying me. My psychiatrist suggested that I should go back to taking the quetiapine at a lower dose. and she said she will help me to taper it down, I started feeling much more confident that I can actually eventually discontinue the quetiapine. So what supported me on this journey? The stories that I heard from other service users and patients who are trying to come off the drugs, a psychiatrist that I could trust, friends and family who were there to support me, the church members who always prayed for me, and me keeping an open mind and exercising, eating, healthy foods, and doing mindfulness sessions. But there were still fears and barriers. They were the withdrawal symptoms, and whether would I continue to receive the support from the psychiatrist? Would I relapse? Would I be discharged from secondary care? What if I need to seek the psychiatrist again? How long would I have to wait for the services? And how is it going to affect my work? What if I cannot find a work, and how would I financially support myself? So these were all some of the fears and barriers that I had. But despite the withdrawal symptoms, which I experienced for the first time in my life, and being aware of the relapse that might happen or occur, I was feeling euphoric, the joy that I did it on my own, especially discontinuing lithium, despite being told that I have to take it for the rest of my life. Friends and family noticed the difference in me. I became more confident. I wanted to use my experience to help others. I continued talking about this, reducing and discontinuing the medication in every opportunity that I had within this trust. But at the same time, I knew that it's not the same for everybody. And within the trust, we even set up a group of people trying to look into medication review. I just want to share that no matter what happens, there's going to be good and bad days. But what was most important was I was in control. I was in control of the medication that I want to take. I was in control about the medication as to what's the amount that I want to take. I was able to voice out and not to be threatened by the psychiatrists or the healthcare professionals anymore. I was willing to take the risk, and it helped me. I also accepted the good and bad days. And I knew, and I know that sometimes I would just lie in bed and not come out of my room. And it was okay. I had my backup tools. My friends would call and check on me. So having a good support was very important. So what is the message that I want to pass on to everybody today, especially the psychiatrists? Communication, communication, communication would be the take-home message. I would prefer, really for the psychiatrists to talk about the side effects of the medications. Talk about the review, the opportunity for service users and carers and patients to have the opportunity to have their medication reviewed. Talk about reducing and discontinuing. Talk about the withdrawal symptoms and relapse. Is there any other alternative medication? And support and empower the service users and carers to have this conversation. I would like patients and service users and carers to remember that you have the right to be informed. It's basic human rights. And please engage with your psychiatrists, pharmacists, or your doctors and have these conversations with them. Do not be discouraged if it did not work for you. It took me 3 tries. Like I said in the beginning, everyone will have their own experiences. I wish all of you the very best, and special thanks to everyone at IIPDW for putting together this conference and giving me the opportunity to share my story. Thank you so much.
Mark and Sandra, thank you so much for sharing your stories with us. I hope you know that they've been received with a lot of love, respect, and understanding. And your stories are really going to support people around the world in, tapering their own medications or developing a different understanding of themselves and, rewriting their own stories. We do have a lot of questions from the audience. I'm going to just pull them together in some themes. I'll start off with where Sandra ended and open up that question for Mark as well. Many people have asked about what really helped with tapering. What were the concrete things that really helped you in tapering off the medication? So Sandra had mentioned things like church, having a supportive psychiatrist, having other supportive people in your life, mindfulness. So Mark, would you like to weigh in on that and tell us what helped you?
Yeah, so I also saw in the chat, the question, there was also what was hard. And I think just to kind of add to that. So when I first started coming off, I was getting really bad, kind of having sweat attacks, almost like really bad anxiety. And I think what was also really difficult was, the minute all these things happened and I was kind of getting upset about these or distressed about these, everyone thought I was relapsing, which I just felt was a bit of a kind of, punch in the face, really, because, there was no thought to why this might be happening. And I think what was also really difficult is every time that I was sharing kind of concerns around the experiences I was having when I was coming off the medication, is everyone just wanted to put me back on them. So I felt that was also not helpful either. So I think all those things made me not talk to professionals around my struggles and make me put my own things in place, because I felt I couldn't be helped by those professionals because no one was actually kind of wanting to try something different. They were just always saying the same one thing. So what really helped, I think, going to a Hearing Voices group was massive for me. Every week I would go to a Hearing Voices group and go and be able to kind of be open about my experiences. They talk about, the stress and the kind of other things and the symptoms I was having. Volunteering was a massive thing for me. So being able to volunteer, I think keeping busy, because if I didn't, I was stuck at home with all these kind of stresses going. So I volunteered once a week, went to Hearing Voices once a week, was a bit more honest with my family, because I normally didn't tell my family everything at the start. So being able to be honest, and I think at the start, when I was first diagnosed, my family were very adamant I needed to take the medication because the doctor said so and we need to follow that. But when I came off the medications and they saw the real Mark come back, I think they were quite relieved and actually really supportive of me coming off the medications and feel like that was a good decision. So that was really helpful. And even just, like going, people kind of asking me about my voices in my head and my experiences in a really kind of laid back motion was really helpful. Not as if they were a problem, but just, these are the things you experience, how is that? So I just think, people not always trying to assume they know what's wrong with me. And then also being able to go to the Hearing Voices group and do other volunteering and go swimming and things was also a big help, just everyday things to help me manage these, because the professionals in charge of the medication weren't helpful, like my GP or anyone. I was just getting bounced. The psychiatrist would say, it's a physical health problem, go to your GP. The GP would say, you're relapsing, go to the psychiatrist. Mm-hmm. And that, that was really difficult. So I put it into my own hands and did those things. And that's how I managed to get through those difficult times.
Yeah. Sandra, would you like to add something to that?
Yeah, I remember once when something happened in the family and I just sort of like screamed at my niece and everybody thought, is she off her meds? You have people thinking like that if, you're not allowed to show your anger or your emotions, and everything is related back to your mental illness. But for me, what was this, knowing what others, hearing from other people, knowing what they were going through. And that really gave me the confidence I too can go. And I didn't want to give up, because I wanted to be, honestly, to be drug-free. Because to me, being drug-free means that I would not be looked at like somebody who's got mental illness. That was in my mind, that having a mental illness is something that people look down on you. So I wanted to be drug-free and not to be a slave to the drugs. So that was a determination, and really the support of my psychiatrist, who saw me for who I am and what I wanted to achieve. So that really helped. Knowing her, now I know that if I give up, that there's somebody who's going to support me. And having that support is so important.
Thank you. I'll use that as a little bit of a segue to talk about families. Many of our attendees have asked about how each of your families felt about you reducing medications, and what was the family's journey along with yours.
I had put them through some tough times myself, because when I was during the relapse period, I was overwhelmed, I was agitated, aggressive, I couldn't think clearly, I snapped at everyone, and then I thought I was going to, and that following that I thought I was having a relapse, but actually it was the withdrawal symptoms. It was so hard for me to share with my family and friends, because they would say, well, why do you need to do this? You stay on the medication, you'll be fine. But some would say, don't take this medication because you're going to be an addict to it the rest of your life. So you hear conflicting stories, but you have to be careful with who you choose to tell your story, what you're going through. And having one or two people who are supportive is more important than letting everyone know. And then you have all these different feedbacks from them. But definitely have someone who knows what you're going through and that you have a fallback on.
Yeah, I've certainly experienced the other end of it when I try to taper off medications for some of the patients that I work with. I've had families call and be very angry or upset. And on the other end, like Mark, you said that your family was happy to have the real Mark back. I've heard that as well, that, thank you for helping us have our child back or have our brother back. So a lot of people have also brought up the issue of informed consent, and if both of you have thoughts on informed consent and psychotropic medication or psychiatric medication. I see Mark smiling. I imagine that there's lots of ideas there.
Yeah, I find this a really hard subject, just because, I remember specifically sitting in the doctor's office when I was first prescribed medications, and everything about them was made to sound like they were going to be the thing. It was going to eradicate everything, that all the voices were going to go out of my head. All these experiences were, I would be in a better place. The medication was, and I would put a bit of weight on. 6 stone or 40, 40 odd kilos is more than a bit of weight, I would say. So I think for me, I felt, if I'm honest, I was lied to most of the time. Also, if I think about it, I always used to wonder, why am I on such high dose of antipsychotic? And obviously I didn't even know that I'd been diagnosed with, schizophrenia in the past or anything, which just makes me think they were treating all these things I didn't even know. So, I really doubt what, that informed consent is used, even currently in services. I think, informed consent is really difficult to make, because you're never really given the full information or the honest information. Even things like, they talk about, some of the physical health changes that you can have when you're on medication, like sexual dysfunction, all that stuff. If I was truly told all the things that were going to happen to me when I took these medications, I would have definitely have thought differently about taking them. But I was given probably and very, very minimum of the real information that was going to happen to me. And I think that's upsetting, and I just think it's so wrong that, and it was definitely done so I would take it and not kind of question it, because if they did tell me all that, I definitely would have thought differently. And that probably goes the same for my family. They were in the appointments, they were told just as much as we were. And when you go look at you can go read the side effects on the labels and stuff, but I mean, the terminology they use on some of those things on the medication is just, you know, it doesn't even make sense. So yeah, I just think there's a long way to go. And yeah, and I think even if you are given information, it's still so hard to make informed consent, particularly if you have to make it in that appointment there and then. So I think there needs to be a lot done around this, because at the moment I think it's failing drastically, the thought of informed consent.
True, and I think there's an additional layer of complication because there's only so much we know about these drugs, right?
True.
So,
informed consent, I sometimes I wonder, because I've come off lithium completely on my own. I say, was I wrongly diagnosed? If I'm able to manage my mood for the last 1.5 years without lithium, so I asked myself, why was I taking lithium for all those years? So where was the consent? And I nobody asked me, is it okay? Can I prescribe this drug for you? This is what it does. There was no communication. There was no, no conversation at all at that time. So I feel, there wasn't informed consent, but I think it is so important to have that. It's so important to talk about it. Yeah.
So another theme that many of our attendees have raised is about being traumatized when you were younger, and how dealing with that through psychotherapy either supported or became a barrier in your sort of tapering process and in your recovery.
Well, I experienced trauma when I was a child. It was abuse. It didn't manifest until in my late 40s, and so it was really traumatic, and I had to go through lots and lots of psychotherapies, and I'm still now finally I'm doing EMDR because I haven't resolved it. And with regards to reducing medication and the trauma, and because I'm having these therapies, so I'm able to actually look into it and work at it, rather than just the medication helping me to overcome that trauma. It's more about actually understanding, dealing with it, talking about it. So I think I can still be able to address the trauma, even if I have come off the antipsychotics completely. And that's how I feel, that I need to do that.
Thank you.
And I suppose, yeah, I had quite a few, I was always kind of bullied in school. I was quite small and things, and, always picked on, but I had 3 big traumas. So I was, abused in junior school and in boarding school, and then was in a really bad car crash where a kind of relative died, and then also had a really bad head injury from rugby, and, that did all sorts of things to me. So, yeah, I think it's really interesting, and I didn't ever talk about those weren't discussed, because I grew up in Africa, where also you don't really talk about those things. So yeah, I think things caught up on me, when I was going through all those experiences. But I've had trauma therapy since. I think that the challenges with the medications I was on is everything just suppressed me. I didn't have a mind space to be able to work through anything, because I was just so zombified. So I've done trauma therapy since. It was kind of helpful, I guess. I did CBT. I didn't like it because the person kept bringing a clipboard into the session, which I really hated, because it just made them feel like they were a robot asking me questions. So that was really difficult. But I think for me, actually, the best way I've worked through my traumas was through the work of the Hearing Voices group, and just being able to reframe things and reconsider. I always felt like, for me, that if everyone was victimizing me or kind of individualizing the thing within me, and it just helped me reframe things. And I've just read about loads of things since. And when I was really unwell, I couldn't read because I couldn't concentrate and didn't have the time. But since then, and obviously doing my masters and things, that really helped me kind of see my experiences through different things. So that's how I've worked through things over years. I wouldn't say I'm completely not affected by it, but I just feel all the things I've managed to learn about and put in place help me manage it. And I'm not trying to, I'm not ever expecting it will fully go away, which I think is helpful, whereas before I did want that. But I'm now just learning to manage when things come up. So that's how I deal with it.
Yeah. Thank you. One of my most profound experiences, again, from the other side of the table has been families calling me and asking me to restart the medication because their child or their sibling has started talking about childhood trauma. And the purpose of the medication was to just suppress that completely, suppress the emotion related to it, suppress any conversation related to it. So again, yeah.
Sometimes there are triggers, although the medication suppresses it, but then there are triggers, like when you see something or hear something or you feel something, and then the trauma comes back again. So even when I was on medication, it was still there. So did the medication really help the trauma? Not really.
Well, thank you so much, Mark and Sandra. We'll have to stop for a short break and then return for a lengthier group discussion. So I know that there are lots of unanswered questions in the Q&A box, and I hope all of you know that the questions have been noted, but unfortunately, due to limited time, we cannot address all of them individually. All right, so we'll take a short break now, and then we'll all return for group discussion.